Good morning. My name is Dr. Susan Marra, and this is Dr. Marra's Medical Minutes with Juju, my 5-month-old French Bulldog, who's in training to be an office therapy dog. Say hi, Judy. Yeah. And today we are going to talk about the early treatment of tick-borne illness, which is so incredibly important. So, what does that mean? If you notice that you have a tick bite or a tick attachment, or you have a bullseye rash, you need to call the doctor immediately. Urgent care, a Lyme Literate doctor, myself, and you need to get on most likely 2 antibiotics. I would suggest Doxycyline and Zithromax because those two cover most of the tick-borne illnesses with the exception of Babesia. And my my recommendation is to be on those two medications for 2 to 3 months. So 2 cycles of replication. It takes about 30 days for the organisms to replicate. So, and the reason it's important is because if you catch tick-borne illness early, you won't have chronic Lyme disease. We know that for sure. That's what the research tells us. That's what my personal experience tells us. And that means that you have to be proactive about finding somebody who can help you. And urgent care would be a good place to go. Also, you can Google Lyme Literate doctors, or you can go to the ILADS website, ILADS, and type in your zip code, and it will give you a list of doctors in your area who will prescribe, um, um, appropriate antibiotics if you have a tick bite. I would also recommend that you send the tick in to your local health department or to Igenex, Igenex, and their phone number is 800-832-3200. Call them, ask them to send you a test kit for the tick, and you can send the tick in and they'll test it for Lyme to see if the tick has it. The prevalence of Lyme disease in the ticks here in Washington is not as high as it is on the East Coast. However, it's getting more and more. In the 17 years that I've been here, I have been witnessing the number of tick-borne illnesses in the ticks here is absolutely increasing. And I think it's largely due to the warming of the planet and the climate change. So you want to make sure that you treat early, and that means, in like the first hours or days of the tick bite. And, you want to make sure that it's properly removed. You take a tweezer and you pull it directly out. You don't wiggle it. You don't light it on fire. You pull it directly out and then put it into a container. You can use tweezers. I would recommend that you use gloves when you pull a tick out as well. And save the tick, test it, and in the meantime, get on antibiotics right away. And that way you're prevented. When you go on antibiotics, make sure that you take probiotics so that your gut microbiome doesn't get upset. And, 2 months of antibiotics is not going to kill you, and it may save your life. So I hope that you have an understanding of the importance of early detection and prevention, just like everything else. And I hope that you're able to find a doctor who will prescribe antibiotics for you. And I hope you have a wonderful day. Take care.